Hey everyone, this is Casey from mycraftyyzoo.com. Today we are going to be speaking with Dr. Erika Montes about unplanned pregnancy. Unintended pregnancies disproportionately impact women from age 18 to 24, women of color, and women from low economic backgrounds. For some women, limited access to education, information, tools, resources, and contraceptions can make it hard for them to be in control of their reproductive health. So we're going to be talking about that today and about making our reproductive health a top priority. Dr. Montes is going to give us tips on how we can bring up the conversation with our doctor. She's a board certified OBGYN and founder of the Modern Mujer Health blog.
I'm Dr. Erika Montes, and I'm here today to talk to you about your birth control options and how to have that important conversation with your physician.
Awesome. So I guess first off, it can be really terrifying for young women, especially where I'm from. It's a small town. Everybody knows everybody. Can you give us some tips on how to bring up contraceptives and to ease the anxiety and how to broach the topic?
Yeah, for sure. Thanks for asking me that important question. I think overall, whenever women have to go to the gynecologist and talk about such personal things, it can be daunting. And overall, I think it's important for women to find a physician that they feel comfortable with, someone that they can just have a conversation with. And if you don't know one, of course, ask friends, family, and though they can definitely sometimes give you good tips or recommendations. But I think if you go in kind of knowing what you're looking for and then taking the questions about misconceptions, that definitely helps to kind of put you at ease and make it a more comfortable conversation.
Those are some great tips. Thank you.
Yeah, for sure.
How do you think that unplanned pregnancies can affect women? Like, what do you see in your practice?
Yeah, thank you. That I see it unfortunately a little more than I would like to. It definitely can lead to health risks such as affecting their physical and mental health, and it can also lead to lower potential in education and in the workforce. But I am seeing, though, that in these last several decades, more women want to take control of their future. They want to make a plan for how to achieve their goals. And I think working with this great company, Organon, which is a women's health company, it's definitely helping me to get that information out there to women such as yourself.
How have you seen the difference in the way the pandemic has impacted? I know in 2020 and we got the lockdown, everybody was talking 2021 was going to be full of births.
Yeah, I mean, with the pandemic, of course, women's routines are changing, their jobs are changing. There was even a survey that showed that greater than 40% of women of reproductive age actually want to wait to have children or even change the number of children they would like to have because of the pandemic. So I think it's important for women to know what their options are to help them achieve their goals. And I think that with this pandemic, we obviously don't know how much longer it's going to last. But I think going out and having that conversation with your physician, and whether it be on in person or on telemed, that's always a great option, and you really have a lot of options for you to do that, to be able to have that conversation.
I'm sure it's easier for you given this is what you do, but how do you bring that up and how do you help people find? When I was young, everybody said birth control, you're going to gain weight, it's going to mess up your hormones. And then there were tons of birth controls that could just, kill your ability to reproduce later in life. So how do you address that?
Sure. I think there are so many misconceptions out there, but I think if you are able to find good information, evidence-based information, and go to websites that will help you do so, you can definitely. I would like to share a website with everyone. It's called whatsnextforher.com, and that will give you definitely more information to kind of help curb those misconceptions and how to proactively have that conversation with your physician.
That is awesome.
Thank you.
I checked out the website earlier. It does have a lot of great information on it, and it was easy to read and easy to go through.
Great. I appreciate that. Thank you so much.
So, what types of birth control options are available these days?
Sure. There's, of course, the more commonly known ones, which are the short acting, which include the pill, the vaginal ring, the patch, and the injection. And then there are the long acting reversible contraceptive methods, which include the intrauterine device, or IUD, and the implant. And then finally, there is permanent sterilization, or a tubal ligation.
Okay. So what are some things that you really would like the audience to know about? Like, if this was just one-sided, what would you tell them?
Sure. I think it's important to educate yourself, make sure you're clearing up your misconceptions, and even if it seems like a funny question or a question that doesn't make sense, we want to hear it, because that will help you make your decision as far as your birth control goes. And then finally, again, it's important to visit websites and pages that have good information. So I'll share again with you whatsnextforher.com. Please visit our website.
Okay, that was awesome. Thank you so much for all of the information.
Thank you. I appreciate your time.
Greatly appreciated. It's nice to know there are minority female doctors out there that can help us with things like this. We really appreciate your help, or your
Thank you.
profession.
Have a great day.
You too. Thank you.
Bye.
Bye-bye.